Unlike some other teenagers, 17-year-old Jim Harley does not complain about cutting the grass. In fact, he is happy to be able to do it. For a year and a half, he was unable to leave the house. Jim is one of 300,000 people in this country who suffer from myoclonic epilepsy, an illness that causes muscle seizures and blackouts. A drug called sodium valproate has stopped Jim's seizures. It is widely used outside this country, but has not yet been approved by the U.S. Food and Drug Administration. Now, Jim's 14-year-old sister Anna shows symptoms of the same type of epilepsy, but she cannot get the drug. What is legal for Jim is not for Anna, and while he gets better, she gets worse. Anna's problem begins here at the University of Virginia, but touches every patient in this country who needs drugs. Her brother got sodium valproate in a university research program. This is one of only a handful of clinics where the drug is being studied. But Anna does not meet research requirements, so she must wait. The clinic is now studying the effect of sodium valproate on other types of epilepsy. But 15 countries have licensed the drug in the past decade, and 120,000 people use it every day to help control seizures. The director of the Federal Commission studying epilepsy, Dr. Richard Masland, says sodium valproate has proven to be safe and effective and should be licensed immediately for patients who need it.
There are literally hundreds of thousands of people in this country who are having unnecessary seizures. There's no excuse for that.
That's the girl. Boy, you've got good reflexes, haven't you?
The federal government requires rigorous testing of all drugs before they are sold in this country. So patients like 11-year-old Holly Winter must be monitored in clinical studies, regardless of the testing that has already been done abroad.
But that still doesn't answer.
But FDA Commissioner Dr. Donald Kennedy says extensive testing may not be necessary for sodium valproate.
Everything I know derives from the experience of people who are clinically competent and for whom I have great scientific respect, and everything they tell me suggests that it's an excellent drug.
Yet it may be several years before this machine at Abbott Laboratories starts producing sodium valproate pills. Without the special procedures set up by the FDA, it would take that long to complete the required studies. Critics say part of the problem is that companies like Abbott Industries are privately owned and want to show a profit. Companies push the development of those drugs which will give them the highest return on their investment. Although sodium valproate would be widely used by the people who need it, the number of possible users is relatively small.
First thing I'm going to do
But Dr. Robert Janicki of Abbott Laboratories insists the development of sodium valproate is ahead of schedule and has always had top priority.
We know the drug is active and that it has a clear-cut therapeutic use, so there would be absolutely no reason on the part of Abbott to in any way withhold maximizing the development of this drug, since the assurance of success at the end is very, very high.
Abbott officials say strict FDA regulations are keeping sodium valproate off the market. But Commissioner Kennedy says his administration has given Abbott a shortcut through the FDA's red tape.
The FDA is not the bottleneck in this situation, and I wish that all the earnestness with which people are addressing their government on this issue could go into trying to persuade Abbott Laboratories to devote more of their resources to gaining the necessary data to win approval for this drug.
Doctors can get special permission to administer the drug while the testing continues, but most doctors do not have the time or the staff to comply with the required paperwork, so only a handful of patients are getting the drug. Linda Bowles' daughter is one of them.
I want to cry. I think it's a shame that medicine has come so far and that these kids have a chance to really perform as normally as any other kid, and we have such bureaucratic red tape, and that's all it is. It's just a political hassle, a political mishmash that we're playing with children's lives.
Anna Harley's condition continues to deteriorate. Next month she will go back to the University Research Clinic, where her doctor will once again try to get her the drug. In the meantime, her seizures continue. There is no guarantee that sodium valproate will help Anna, but she and others like her won't know until they try it. Bob Dotson, NBC News, Stafford, Virginia.